Uba uMdaka uyindoda ekhaliphile, uyindoda esenza ngokuzimisela, uyindoda enesifiso ezinhle uyindoda engathi ayisafanelanga ukuba kule ndawo le kuyo manje sekufanele ithuthuke iyobona phambili amadlela ahlaza ukuthi anjani. Usuyidlalile indima yakhe emapatientini bavukile babuMdaka baphila.
Kanje awuzwakali.
Angizwakali. Ngiyangizwa manje.
Awuzwakali.
Manje, what's the point of me sitting here?
No, it's the reason ungazwakali, it's not because awukhulumi, but it's because usemuva.
Ngiyazwakala manje.
Yazwakala manje. Sawubona nkosazana.
Sawubona.
Kunjani?
Siyaphila.
Siyaphila. I had this sit down with Umugelani before. We recorded for 3 hours. And when we were done, only audio was available. And I didn't like that. So ngamtshela ukuthi no, Mugelani sohlala phansi. The reason I want to sit with Mugelani nkosazana, it is because Umugelani, since I came here, he presents a different view and outlook in life. And some of the things that he represents or he believes in are things that one, I'm not familiar about.
True.
Two, some of them I don't agree with them.
They're controversial.
Too much. They're too much controversial.
It's because we live in a world where we have to say things that people agree with it.
Yeah.
If they don't, then they cancel you. And we no longer live in a world where it's about the truth. It's about yomphatha kanjani omunye umuntu. You know, so we say things that we know that the other person will like them. True. Not necessarily what
we're
the
supposed
truth
to do.
it's supposed to be.
But why are you so confident that what you're saying is the truth?
Most of my views are not necessarily based on what the media is portraying or what the hearsays. I'm more of rooted into the tradition, ways that our forefathers, our fathers were doing it. So by the way, the background is I'm a village boy.
Yeah. Well, let me take off my jacket. I think it's because it's not Kilebu Hill. Yeah.
You are burning.
I'm burning. People are burning.
So, if you look in today's world, the voice of a man, particularly an African man, it's being silenced. And if you look around in many sectors, you look around in social settings, you will no longer hear the voice of a male because it's no longer fashionable, if I was to put it like that. Fair enough, if you look at our history, you can talk about big terms like patriarchy and stuff.
Yeah.
Fair enough that other people need to be given the space to talk. It's fair enough. But you don't have to silence the voice of a male altogether.
Don't you find it interesting that this guy is talking about the voice of a male and he went to the profession where they're going to call him sister?
And it's the Lancellot.
It's Lancellot.
It's some of the things that we need to talk about that at one time to say the cultural aspect of it.
Yeah.
Males in nursing in relation to our African tradition. What does it do? Does it then makes us look weak as a male in nurses, and as male in nursing in general or particular? But then look, there are certain elements that the profession on its own contradict our culture. Let me give you an example. Some of us were trained as aquachas, what will be known as midwife.
Yes.
As a male, when a woman is giving birth culturally, you're not supposed to be there.
Yes.
And some of the times you can only see a child after 3 months. But now, here you are, not only are you there, but you are partaking in the process of the delivery, you know. You are assisting this lady to deliver. That on its own is controversial. That on its own, we need to look at it in the context of our culture as black men? Is it the issue of we're doing it because of opportunities? We're doing it because of money, or we're doing it because we like it or we love the profession, particularly when it comes to midwifery, because it's controversial on its own.
So, according to that reasoning, are you saying that midwives or architects are males that are responsible for doing midwife duties? Are you saying that architects are not supposed to take part in the delivery
No,
process?
I'm not saying that. I'm saying on its own, if we look at it in the context of the African tradition, what is the impact does it have on the image of a male? Number one, you as a male that is an architect, that I am one. What is the image? If we were to sit down with our forefathers and sit down with our fathers, some of us, and I say to them, no, my role is to deliver babies. Well, how will they perceive me? Will they accept me as a complete man? Or will they see me as a weak man? Or will they see me as or maybe a modernized man?
Yeah. Maybe let me start here. Do you think men belong in nursing?
Good question.
It got him thinking, because now the more he...
I need to choose my how I answer it, because my controversial ways will be no, in a sense, if we were to follow culture. But now remember, nursing is a career now.
Okay.
So if something, when it's a career, it's a profession, you have a right to choose and go and study it. It's no longer, it's now more diverse. Nursing is now more diverse than any other time. If it was a traditional nursing, the answer would be no. But because now nursing, it has many opportunities. Like you can be a nurse but don't touch a patient.
Okay.
For example, you can be a nurse without nursing someone. You understand?
Let's talk about the nurse whereby you have to nurse someone in the ward, where you're supposed to change someone's nappy when they are sick. The nursing where you're supposed to bath someone when they wake up in the morning routine. The nurse that is doing the kind of nursing that you were doing in Baragwana Hospital. Do you think men belong in there?
Let's put it in this way. If we were to give a boy child an opportunity to choose, a fair opportunity to choose a career without consequences of social standings, you will find that it will be only a minority that will actually even choose nursing. If you will be lucky even if you were to get 1%. Majority will be, we chose it because of the social standings.
As men. You don't think that there's men that are called?
Nah, I don't think nursing is a calling. I think it is a profession.
You know why I'm asking this? It is because most patients that I've encountered, even here where we are currently working, without mentioning the employer, I have noticed that females prefer male nurses over our female counterparts.
What
And
could
then-
that be?
I don't know, because I think they're so good at it. They are born for it. And here he's saying that given the opportunity that we could do anything without consequences, nursing wouldn't be a choice for most male nurses. What do you think about that?
Look at it in this way, Silta.
Yeah.
Contrary to belief, males are very very good in caring. Look at it in this way. For you to take care of a family, it means you care.
Okay.
And we've been doing that for many years.
Yeah.
We've been taking care of our women and children. So to look after someone, it's one of the primary roles that we have as males.
Yeah.
So we're actually good at it, because particularly if it comes to females, because that's what cultures made us to believe, that we need to take care of women, and you understand. So we do have soft spot as males, particularly when it comes to women. We do. And one of the reasons why you might find that male nurses are showing traits that they might be nursing better than the female counterpart is because, number one, males do have patience.
Do they?
They do. Male. You know, let me show you why we say you cannot sustain a marriage for 40 years if you don't have patience.
I thought it was sustained because of the patience that he showed by the woman.
It's look at it. If you look at the divorce rate, you will see that it's women who initiate divorces, not males. It's rare where you see a male initiate divorce.
Yeah, because you guys want to abuse women and want to be comfortable in your abusive ways.
Not necessarily
They're
so.
abusing us.
Yes.
Not necessarily so. But coming back to nursing, we as male nurses are more snozwelo, man. I don't know if I ngesilungu kuthiwa. You know,
Empathetic.
Because she's a female, we know that already as a female person. To us, already uza umuntu ngathi vulnerable because you know we have this upper hand being masculine and stuff.
Yeah.
So we become more gentler when we deal with them.
Yeah.
So that translates into confusing to say the person is better in nursing than the other. When you look at the nursing on its own as a science, and you look at the care that the person is receiving, it might be because socially it's influenced that I have a softer spot for the female.
But does that make you more masculine or more manly or weak? Kilebuhile, I want to bring you into this. When you see a man as caring and as soft as this majority of the male nurses are, what comes into your mind? Do you think, I'm a sissy boys now? And no wonder they are called the sister.
I mean, I've never been to a male nurse.
Serious?
The funny thing is for my family planning, I decided to take utato, you know, and then tato is off the whole week, and I had to ask another person, which is a female. I don't know why, but I think I'm more comfortable with a female because I think our bodies are the same. They'll understand me more.
Have you been in contact with males?
I've never been in contact
I think
with
in this case it will
nurse.
be very biased because the thing is she works, we are her colleagues. If it was not for the issue that we are colleagues.
And she's not a nurse, by the way. For people that are watching outside here, Kilebokhile, our ghost lady for today. I had to go buy a mic just for her. She's our ghost lady today, and she's not into the profession yet. We work with her. She's a safety specialist.
Yes.
Yes, and
My profession.
yes, and one day I'm gonna have a sit down with you.
Yeah,
Also
you
in
should.
environmental.
Yeah,
It's only
environmental health practitioner.
Okay.
My profession.
So she's in the alliance.
She's in,
Yeah.
we are together. Okay, Lancellot, you keep on referring to culture. Every second word that comes into your mind is culture. Why is that so important to you? Especially, I'm going to ask you as an individual and then as a professional nurse, why do you feel the need to superimpose culture in the nursing profession? What does culture have to do with the profession of nursing?
Context, I think context is everything.
Okay.
You see, in Africa, we have lost identity because we adopted identities that, I will say identities, because we didn't adopt one. We adopt many of origins that we don't know of.
Okay.
And we don't have any reference of those cultures. And now, because of that, it impacts on everything. Remember, culture talks to the issue of identity.
Okay.
Many of us no longer believes in it. Because why would I want to believe in culture and identity when I don't even know my father? So we have an issue where, that's why I'm saying males in the society have been silenced. And if you want to talk about culture, you need to have to talk about the normal structure, family structure. A normal family structure where there's a father, there's a mother.
Okay.
You understand? Then there's a child.
Okay.
Because as a child, you then learn, your father will then display certain elements that you will learn to say, okay, if I'm a boy child, this is how am I supposed to behave as a boy. You understand? if you are a girl, then you see, oh, okay, this is how a man's supposed to treat me as a girl child.
Okay.
You understand? And then you start seeing the relationship to say, okay, male and female, this is how they interact. You understand? And then from there, then you see, oh, if you are a female, oh, okay, eventually my roles in the household will tend to be like a motherly role. And as a boy, you tend to see, oh, okay, my role, I have to be like this gender. You understand? But now, when you remove that family structure, you cannot talk about culture. You cannot talk about traditions.
So the tradition begins from the family structure.
Yeah, if you remove the family structure that I will just say normal, you cannot talk about culture or tradition. And the reason why South Africans today, we don't talk about culture or tradition is that those family structures that where there's a male and a female, mother and the father, they are no longer there.
But what happens if they are like grandparents? Are we saying that just because there's no mom and dad, there's no culture?
It is there.
But what happens if it happens that you are groomed by your grandparents?
It is there. And remember, in the absence of a father, your uncles become the father. In the absence of the father, your grandfather becomes the father. In the absence of a mother, if let's say a mother passed on, the grandmother has to assume the role of the mother. The aunts have to assume the role of the mother. You understand? But now, how many families in South Africa can now tell, honestly say, I'm in contact with my aunts. We have relationships with my aunts, healthy relationship with my uncles. We are in talks with our grandparents. Now in South Africa, when you look at things, because now in South Africa, one of the biggest issues that we are having is that we are failing to maintain healthy family structures. Because as Funuk tells us, we are always right. Remember when you talk about family structure, there's hierarchy.
Okay.
And when we were younger, they used to tell us this issue of saying, no matter how educated you are or how moneyed you are, you will always remain a child to your uncle.
Yeah, you're always a child.
You understand? But when you look at South African family structures now, uthola ingane na 26 just because iyasebenza makunama family gatherings or family meetings khuluma yona ngoba iyosebenzayo. And then our uncles, they now keep quiet. Abo auntie because uyozokhokha. You understand?
Kahle khuluma imali.
Khuluma imali, yabona
Money talk.
Money talks.
Then the uncles automatically become bullshit. Then they have to walk.
So how are we bringing culture into nursing?
Yeah,
How you combine
Actually,
those
that's
two
my
together?
next question.
That's where I want to come in.
But wait, before you go there, you see now this is interesting. What kind of family structure do you come from?
I'm from a matured marriage. In my definition of marriage, I consider my parents' marriage a matured marriage.
They were matured already when they got married.
No, I'm talking about the marriage, not the
His
individuals.
definition of marriage.
That's what I'm trying to.
Parents.
Not
What's
the
matured
individuals.
about the marriage?
We want to know.
Yes.
Yeah,
I'm
he's
not
coming
talking
there.
about the individuals being matured. I'm talking about this
the
union.
unity. Yeah.
Yeah, being matured. When I was born in a marriage where it was already 40 years in existence, the marriage on its own. Understand? So the gents, my parents, they knew one another's.
Wait. So you're born after your parents got married. 40 years later.
Yes.
And
How
then
old
they
were your
had
parents?
So when they
You're old.
when they made me, my father was already in retirement. You see, so the gent was already in retirement, and then
So we can say 60.
yeah, it was above 60,
Okay.
and then my mother was in 50s. Yeah.
How did you come out healthy and alive like this?
It depends,
Because
Chana, it depends. It
I
depends.
think about a much.
You need to look into some things. That's why I'm saying we followed a lot of identities that we don't know. Back in the days, a man at the age of 90 can still impregnate a lady. But today at 35, you reach what is called male menopause.
Andropause.
Andropause. What? Because of smoking and drinking. Understand? But back in the days, as a giant, you could go even 100 years and you still have good quality sperms. You see, so what I was trying to say is, being of culture. When you look at the South Africa, remember South Africa, it's
We
not.
still, Lanos, you jumping. We still want to understand the parents' issue.
What?
unity of your parents.
Yeah.
What was matured about
The
them?
structure, yeah.
Okay.
Your structure.
So the structure on its own, because I'm from a father and a mother, whom they were together for 40 years plus before me. What I've observed, I would be lying to you if I said to you I've observed my parents arguing in front of me. And that's why I classify it as matured, because these people have passed so many stages. 2, they were no longer working. It was only my mother that was working. Mm-hmm. So I had my father, Obabam was always in the house. He will sometimes walk me to school. You understand? So there was no this issue of you will be raised by the television. You will be left alone, come back from school, and you won't find anyone in the house.
Because mom and dad,
they had work, you see. So I didn't experience that. 3 is that they had enough time to a point that every evening, because of, remember, when you are still young couples, you are wanting to climb the ladder in your careers. You invest time. It's either education or you're doing work and stuff. With my parents, in the evening, it was story time. They were telling us about the family history. They were telling us about the do's and the don'ts as a person. Even till today, when I'm in my house, there are things that I can't do.
Because you were told.
Because I was told you these things, you must not do them.
What are some of those things that your father told you?
There's many elements. Number 1 is, let me just give you a simple thing. Simple thing like cutting your hair. We were told you should not cut your hair at night.
Or at night, isn't it? Because the hair might go to the food.
No, it was not because of
things like amazipo.
Yeah, like things like amazipo.
Yeah, because when you cut your hair at night, then whatever that you are cutting might go into the food.
It's not
like
about the food. It's not about the food.
They hide it
But
with
I'm
bad
lawyer.
luck.
No,
They hide it with
it's not
bad
about
luck.
the food, because remember, ikichi, Emaka, it's outside. So food is always prepared far away from where you were sleeping or where you were watching TV. So it was not about that. But some of them that we were taught by our own father is that you can't.
Okay.
Because, for example, if you say, in my household, there's a rule, I say, I'm just giving an example. At 6 o'clock, I'm closing my gate.
Yes.
Ne? As a man, how will you enforce that rule if you are outside drinking or if you are outside? So the kids will do as they please. And the kids, because they're very intelligent, they will mark you, they will see, oh, baba nang lapho saphuza. Mawuphakama, then khona bayendlini. Understand? But if you are in your house at 6 o'clock and you lock yourself, you know you are in the house, you will enforce your rules the way you want them to be enforced. And that role of being a protector, you take it very serious, that you don't allow anyone to be outside, because 1, how do you then protect your wife who's outside Epsug when you are not there? And even if you are there, what will you do Epsug? You see? So there are those elements that even today myself, I don't still feel, uyabona uma ngashaya u10 ngekho endlini yami, futhi 10 is too late. Around 8, I feel no, I need to be there.
Being the guy that he's brought up with this structure in mind, a guy that knows the do's and don'ts, what is expected from a male or a man figure, not only that you've been told, but you've witnessed it. How did you end up in nursing?
Good question. What led you to nursing?
You see, in South Africa, many of us, there's this thing what we call, there's mixed match of skills in South Africa, and there's also choosing of career in terms of your socio-economical background influence your career path as a person. I've never dreamt of being a nurse, never wished of being a nurse.
And that time you're so good at it.
And never really did I see myself that ngaba a nurse one day. You understand? But because of socio-economical setting of our country, which also goes back to culture, I'll link it to you with culture. Why I mean so. It forces the majority of young people in career spaces that they are not passionate about, or that they are not even thinking of doing. So I had to choose nursing. And it's funny how I chose nursing. is one of your speaker once said one of the issues that makes us to nursing, one is the stipend, because when you study as a nurse, you get to be given a certain money as a form of stipend or stipend. Two is the issue of if you choose a career that is, for example, long or too difficult, perceived too difficult, like engineering, there's a possibility of fail. If you fail, you'll be happy.
That was the episode that I had
Yeah.
with Ongaba.
Yes. So that is true. So imagine me, I was born from an advanced aged parents. By the time I was a teenager, these guys were no more. So meaning I could not choose something that I will fail at, number one. Number two, I needed something that will get me to be independent as quick as possible so that I can change my background also.
Yeah.
So you don't choose it because you think you loved to being a nurse, or majority of us chose it because the socio-economical status of this country
Forces us.
to. For example, a lot of young people that we grew up were good in mathematics, were good in science and stuff. We could have been far. But some of them today, believe you me, some of them are traffic officers, cops, teachers and stuff, because we choose these careers that will get us employment quicker. You see, not necessarily because we are passionate about it. So if I want to link it back, yes, as a black people, we have lost our sense of identity in a form that we are lost, even when it comes to careers. Says tata normal that the system gives us, because we don't have a foot to stand on. We have nothing. We own nothing. There's nothing that we own. We don't even have land. Even if I wanted to be a farmer,
What did you want to be? If everything was abracadabra, Lancellot can have whatever he wants, what is it that you would have preferred?
Politician, probably.
Okay,
A
look.
politician. Why? Why you say
Why a
that,
politician?
Lancellot? Wanna kill it?
Lancelot talks for days.
So politics.
On my politics.
Why
nje.
not lawyer? Being
Or a lawyer or something, man.
Something you
Hence,
could-
I feel like this career was not made for you.
No, it's not.
Was not made for you.
You will be surprised. Taking care of the sick or the ill, it's one of the things that I'm passionate about.
Okay.
It's one of the things that I've always wanted to do. As a young boy, I've never dreamt of anything else except being a medical doctor. So there are certain elements that, as a person, you must take your own faults on them. Ne? As much as the system is faults and stuff, there are those that are from rural areas that they've done medicine, even though there are few.
Yeah.
Because medicine, the criteria, the selection criteria on its own is biased in South Africa. And I know that the mainstream media will not want to talk about it.
Why is
But-
it biased? No, man.
It is reserved for whites and Indians. You can
You want to get me cancelled? Well, I'm still starting this podcast. This guy wants to get me in trouble.
yeah, but
no, it's okay. We will excuse Ukilebuhile. Thank you very much for joining us, Tentom.
Enjoy.
Thank you very much.
yeah, this is the next
Aye,
time.
next time
so
sutala early, man. Ungasabi.
So Itala A.
Kilebuhile, put your mic off. There at the top there.
On
And then
and
they
off.
on and off on the side. The mic
mic on
itself,
its
yeah.
own.
Hey, bamba ngatu bambi vibrator the mic yami.
I think I might find you someone to interview. Who was a nurse.
Go speak there. Go speak in the mic. Go speak in the mic.
Very.
Go speak in the mic. Is
There's a guy that I want you to interview.
yeah,
He's a family.
friend.
No, he's family. He's
Okay.
a family. He was a nurse by profession. And he went into those reps, those medical reps.
Okay.
And now he's probably a manager in some company.
Okay.
So he's matured. I think he's done all of these career lives and whatever.
Oh, wow.
I think it would be interesting.
You must hook me up with him. I like to have.
I'll hook him up with you.
Yeah, I would like to
hook
have
him
that
up
interview with
you.
him. Okay.
I'll let you know.
Thank you very much.
Very intelligent, smart man.
Ne? No.
Sabonga.
Kubonga mina. Thank you. Sharp.
Umbulisi umntana. Sharp ntwanas.
Yes.
So Nollen, the thing is, we at some point as a country we need to be honest with ourselves.
Yes.
In this country, even when you to look at business on its own, it's not easy. There's so many red tapes that are there. Even if you go and interview nurses that are doing business, they will tell you it is easy for a nurse practitioner to open up a private practice and they will have clients. But as a black person...
So it's easy for a white or Indian nurse
practitioners. For example, I think even medicine is still have that issue that even doctors, if you go to Flora Clinic, okay, let's not mention them, you go to these big hospitals, these 4 private groups, to get a suit there, they will tell you, if you will find few black doctors, the ones that are, in South Africa, there's levels. The higher ones, the top-notching ones, if you go inside the hospital, the suits, the medical doctor suits, you will find that it's mostly white. But when you go, those ones, there's a Tolelokshini.
Yeah, the junior ones.
Yeah, the ones, the hospitals you Tolelokshini, also Tola Kona, the black doctor's lab. And it has nothing to do with competence, because if you look at competence, they have good black doctors that are competent. So there's a lot of red tape. Even when you talk about renting of a shop in a mall, there was a lady that once talked about this issue to say she had a restaurant and her rent was around 20-something thousand. EFF actually interviewed her and intervened. She was expected to pay about 20-something thousand. But when she looks at the same shop size with the next person who's owning, who's white, they were paying around less than even 10,000 in the mall. So there's so many red tapes, not only in the education, not only in the private sector in terms of business or in terms of everything. South Africa as general, black people are finding it difficult to get into certain spaces, to penetrate certain areas. Even you look at the higher positions in private sector. You look at all the top CEOs in the mining industry. You will see that there's few black men there. You want to tell me that black men are not qualified CEOs? Look at the banking sector. You will see what I'm trying to say. So when I say it's reserved for the certain group, even those that go in as black people, is the black elite, the ones that are from
majority. Because I know some people from very humble beginnings that are doctors.
Yeah, they are. But you must also look from which university. Because in South Africa, there are certain universities are reserved for certain people.
So you mean I can never find an elite? Let us not go into medicine and all of that, because that's not our niche.
Yeah, it's not our niche. Yeah. But now let's also look at it in this way.
Yeah.
When we were training as nurses in our class, there was only one female student who was white.
Out of
we were 400 plus in class.
Only one white student.
Because my student number, it was 409. So our student numbers were based on the number that we were. So it's a year and then the number that you were in class. So, and if you were trying to locate that white lady or even any other lady in white female nurses, you won't get them in the system. You won't get them a Bara. You won't get them a Tembisa. You won't get them a City of Joburg clinics. You won't get them you'll start funding them maybe with this scam, maybe, but most of them will be managers in these top high hospitals.
In our group, out of 50 students, we had 2 whites and 2 Indians.
And then can you locate the whites in the system?
Okay, one is working I know somewhere in ICU, in a hospital
what?
in Pretoria. I'm not sure if she's, I don't know if she's still on the floor.
She can't be on the floor, Chad.
No, man.
She can't be on the floor.
No, she should be on the floor. I'm gonna have her. It's a matter of time. I'm gonna have her in the
check
interview.
it out. You will see.
And then the other one, she's working for a private
hospital
company.
group. And what
It's not a hospital. I don't know. It's a medical. I don't know if it's a medical supplies or an agency or something. Yeah.
So you
And
want
then the one Indian lady, she's in America.
Mm-hmm.
And I don't think she's practicing as a nurse anymore.
Yeah.
And then the other one, she is running a radiology unit.
You say running. The word running.
Well, but still,
the word
still
running.
she's on the floor. But I get your point.
The same year we qualified.
Yeah.
People were appointed to Bara. We were appointed to Bara.
People that you qualified with.
Yeah, so some of those people are still a Bara as same professional nurses, same level. They do want to move. But yeah, Chada, it's survival of the fittest. Because the opportunities are like a pyramid.
In nursing.
Only few can get to the top.
In nursing.
Yeah, not only nursing as black people, as black people.
Yeah.
Even when you look at business, there are many people who started businesses as entrepreneurs.
Okay,
but
hold
those
on. I'm not hearing you anymore. Yeah.
So, can you hear me?
I can't hear you. Something happened.
But yabonisa la pamas.
Yabonisa but mina ngikuzwa. Nama ngizizwa. Speak?
Yeah, much.
Yeah, ngiyakuzwa manje.
Okay. I was still saying, not only nursing.
Yeah.
In South Africa as general, as black people, our life existence, it's like a pyramid. Yeah? There will be those that will push from the bottom until the middle. And there will be those that will push until the top.
Yeah.
But those people, it's going to be few. It's going to be few. Hence, if you look at, we in South Africa, when we talk about a billionaire in dollars, for many years, since 2004, it has been Patrice Motsepe.
And it's been raining, man.
Since 2004, we haven't had another black billionaire in dollars. Yes, we do have billionaires in rands who are black. You can with the champ who owns Gijim. There's a lot of them. We have a lot of millionaires in rands, but in terms of billionaire status, it's only Patrice Motsepe. How many years? Look at 2004 and look at now. It's only still one guy. But if you go to countries like Nigeria, you will find a lot of billionaires in dollars. And to be surprised, what you will also find, you will find a lot of young millionaires who are black. And this goes back to the issue of grounding. Black people in South Africa, we don't have grounding. We don't have ground to step on. We lost even identity. We have nothing. We have no identity, no land, no opportunities, no jobs. If you look at our stats in terms of unemployment, what you will find is that there's more young people who are unemployed, and particularly black people.
Do you think nursing is targeting those people based on the current status quo? Do you think the government is targeting these people that they know what they have nowhere to go? This is the only hope, with the alpha and omega of options that they have. Therefore, they will come and do nursing.
You want us to be controversial?
It's not being controversial because no. Maybe let me give context and background to what I'm saying.
You are telling the truth.
Yeah, because wait, let me say something. So that you don't think I'm putting you under the bus, right? I've had many sit-downs with nurses, right? On record. I haven't met any nurse that says they came here because of passion, and it wasn't because of their socio-economic background and standing.
Yeah,
So
let me just come in there. It is true that nursing, on its nature, it's attracting the people from a poor background. There are few individuals that comes to nursing who are from good background. There are few. I mean, when we were training, there was a lady that is from, I won't mention family what she was from, but she was from a well-connected political family. And apparently when the mother died, left her a lot of money. So you could see even the lifestyle.
That she was living.
Yeah, tina masiye emateksini yena bekahamba ngemoto yabo.
Yeah.
Eskela ndihlala kuma townhouse tina masihlale eResland igcwele amaphela lapho. Ebhedlela kulama heater lawo, heater yase Natal Street, the old Natal Street. The heater on its own, I don't know whether they were beshisiswa amalahla, but bozothola ibona limnyama.
A whole fire hazard.
No, like imagine if ibona limnyama, what are you breathing when? So,
I hope there are no nurses in that dress anymore.
we were, but we were there. We were trained there. That's why mhlambe namakhanda athi cela intuthu. So
Yeah.
Let's deal with this matter. The matter is, because of when you are from a background that is not so well, you don't have many opportunities.
True.
You don't have, even if how brilliant you can be, you don't. You will take what is presented to you. So by that virtue, a lot of people then goes to nursing and say, because this is something that we can do and we getting something that we can assist at home. So it attracts people from lower social backgrounds mostly. And then secondly, and many of us that are also here, including myself, okay, I'm not a reject of other profession, because I did not study something and I couldn't finish, then come back.
Yeah.
But some are rejectors of other professions. You understand? Some umuntu akathathiwanga ku-engineering, umuntu akathathiwanga maybe pilot or something, or abayithandayo, or chartered accountant or something. Or some even studied, completed the degree. Some in chemical engineering, but because there was no employment, then they come to nursing.
Yeah, we had a guy that had, I think he was an electrical engineer by qualification, and he was doing nursing with us. Another lady was doing psychology, came back to us. Another lady was doing education, came back to do nursing. Those are the rejects, the fallen soldiers.
So the fallen soldiers in the other professions. So that is said, because you find someone that went to school, showed a huge competence in terms of maths and science and stuff. Some of them even have degrees in these professions. But because of employment status in this country, China, the economy is in the hands of the few minority, which they decide who they want. And those that they take, unfortunately, must also seven these big companies, you then think you are the clever black and you are better than the blacks that are outside the system. And that's where the big problem comes in, because we don't fight together. Let me give you an example with Fees Must Fall. Fees Must Fall affected, I don't have stats, but I can tell you Fees Must Fall affected 90% of black people's households. Fees Must Fall directly.
How so?
A lot of us can't afford vets. A lot of black families, there are few that can honestly say, between paying bond, paying a house, paying the rate and whatever, they will have money to pay vets or pay UJ
For a child to do medicine.
So Fees Must Fall. That was those kids when they did the strike, or when they were striking. All of us as black people should have went and joined them, because it affects all of us. There's only maybe 10% of black parents who can honestly afford their kids to go to university without assistance. Majority of us are China, we are west. As we are from the rural areas, we are West China. The registration, your parents can't even afford to pay registration.
Yeah, I've met people that couldn't come to study because they couldn't afford a 3,500 or 4,000 rand registration fee.
Yeah, the question that we need to ask one another now is, why in 2023 are we still having registration fees?
It's the system. It's private. Remember, after all, VEDS, UJ, UP, these are private institutions.
Yeah, but they claim to. When if you go to Google, they say to you it's a public institution. But there's board of directors, the stakeholders, but they label them as public institutions.
And they make profit.
They are making profit.
Yeah. Let's go back to nursing. What does nursing mean to you? As a black African male somebody.
I like the emphasis on male, black.
Yeah, because those are the key indicators that make you, you are as a cultural black African male.
Let's start here first. What does nursing mean in the black community? Let us start there. Then you will understand that it's losing its meaning.
What is it, according to you? What is it?
So you want the definition?
What's the intended on the black perspective? Not according to what Florence and Nightingale and Charlene Downing and Agnes McCann define it to be. As Lancellot Muhlare.
In the black community, nursing has no value.
Man, don't say that.
It has lost value.
Don't say that.
You know why I'm saying that?
Why?
How many people respect the profession?
We will go to that. Wait, we will go to that.
If you were your epilepsy,
yeah,
and you are in the crowd of people, even a taxi, how many people will even envy you, even wish to be you? Actually, that's well. You see, the thing is, as I'm saying, we need to, at some point as the country, we need to decolonize a lot of things. We need to first have our own definition of what is a certain thing to us. Because mina la ngikhulele khona emakhaya, ugogo akafuni ukuya esibhedlela. Ugogo would rather die endlini than going esibhedlela because ugogo utshela ukuthi la manje aseyongibulala.
So grandmothers don't want to go to the hospital because they think nurses will kill me. How did we get there? Maybe give me according to your definition. Then we'll move to how did we get to where now the public don't even envy us, because nursing is preached to be a noble profession.
It is.
It is preached to be something that one should take pride in partaking in. Nursing is preached to be the backbone of the health system.
Let's just talk about these three things you talked about.
Give me your way.
Before I give you my definition. I'll give you my definition.
Your definition
No, I want
allow
to
me.
talk about these three things, Mr. Mdaka.
Okay.
You say it's a noble profession.
It is, yeah.
It's you must have pride in it.
Yes.
Did you say that?
Yes. It's a noble profession. It is something that you need to take pride in partaking.
Yeah. So let's talk about the pride issue. For me to take pride in something, that thing needs to protect my dignity.
Okay.
So the question is the profession protecting the dignity?
We're going to get deregistered by some here. Guys, this is just our opinions. Okay, it needs to protect our dignity.
It needs to protect your dignity as the person.
And you don't think nursing does that?
I'm asking you a question. Is nursing protecting the dignity of the professionals that are practicing it?
Yes.
Okay. How so? Because we're living in a world where your dignity should be protected in so many ways. If you can't afford to buy a house, what dignity are you talking about? Your peers who are engineers are driving M3s. You can't even afford a Suzuki. So your peers goes to Woolworths, Apuzama smoothie. That's the Woolies. They're eating chicken, laying a frizang as a Woolies. Actually, Woolies, you won't find their frozen meat. But because we're in only 17,000, you must go to Cambridge and buy the big 5 kg of
Polone.
of a fry pack. Because it may last until near 15, because you can't afford to be going to the shop every week to buy fresh produce, whether it's meat or vegetables. So what dignity are we talking about? Let us not be in a fairy tale world. Let's live in the reality. The reality is a profession that gives you pride, or that you should be prideful of. It's a profession that gives you dignity. I mean, if all nurses were having a well-structured bangahlala emkhukhwini, are you aware that there are nurses who are rented eSoweto emkhukhwini? Are you aware ukuthi kunenurse ubanda kangaka uvuka ngo4 ame bus stop ameli taxi?
Let's keep it to English. I want the whole community, the whole world.
No, so are you aware that there are nurses that wakes up around 4? They go to bus station, stand there, wait for a taxi.
Public transport.
I remember when I was doing my community service, I unfortunately I'm one of those people that I don't conform to the status quo. So when I did my community service, I told myself to say, I will never buy a Luxin. I will never buy a house in the township. Whether I afford or I don't afford, I'll force it. I bought a house in the northwest suburbs of Gauteng. And I had a challenge with transport. Because after 6:30 to 7, the last taxi at Brie to where I stay leaves at around 7. And at 7, that is the time you knock off at Bara. And you needed to take a taxi from Bara, either Bara to Josie to where I stay. Or you take a taxi to Clearwater. Then you will walk from Clearwater to the house or whatever. Or you will take an Uber and stuff. But the last taxi leaves at 5:30 to 6. A taxi rank.
Para taxi rank, yeah.
To Clearwater.
Yeah.
Now, mini routine, the routine finishes at 7. You see, now, let's say I do get a taxi. I now need to beg the taxi driver, can you pass Clearwater? Can you understand? So what dignity are we then talking about? And then what is it that I should be prideful of?
When you don't want to share public transport with the community. Do you think that decreases your dignity?
No. But look at it in this way. I'm giving you circumstances where I'm not saying by being in the taxi, it takes your dignity down. No. I'm saying to you, for you not even been getting that taxi, by the time you get to the rank, I say I call a taxi, the taxi is not there.
At all.
In the morning, you need to be in the ward around 6:30. Let's say you stay in Tembisa and you work in Bara. You wake up very early. It's raining, you're standing at the road. By the time you get to work, you are wet, Chana. There were instances where I got to work wet. There are instances where I got to home wet.
And that thing compromises your dignity.
As a person in China, who forget about epilepsy month, what are you working for? No, let me ask you, what are you working for? You can't even find. You are wearing a full uniform, and then you wear white. You are wearing full uniform. You know as you are coming when it's night. That white stands out. Umans, you are wet with your epaulets. And someone who even does not even have a matric is driving a car. So that's what I'm saying. As South Africans, there's many things that we need to talk about them. And need to restructure them to say, what do they mean for us before we adopt definitions of what we don't know, including the word profession. We need to start asking ourselves, what is a profession in our own context? Because if we take a profession and what we look at what the profession is and how nurses are being treated, you will realize that no. Well, you will realize that what I'm practicing is not a profession.
What is it? It's a side hustle.
Side hustle have a lot of dignity. If you go to a lot of places, nurses are not happy of how they're being treated.
By the employer or by the
employer,
client?
their managers, the other healthcare workers, other profession that we work with them and stuff. So what I'm trying to say is it is a noble profession, I agree. Because looking after someone who is ill, I mean, you have been given, if you are a spiritual person, you will understand that God has given you an opportunity to look after someone when they are vulnerable.
True.
When they are at their lowest.
Yeah.
And you watch that person is it's a wife to someone, it's a mother to someone, and you watch that person regain their health back and they go back home.
And it's beautiful.
That's a beautiful feeling. As a person, I think most of us, that's what sustains us. Because outside that, there's nothing you can afford. At least you afford to take care of someone and that person's life.
And go back to the takes.
And go back to the takes. You understand?
Because I've heard someone saying that if most nurses, they can either afford to buy a house and not a car, or afford to buy a car, a good car, and not a house.
Yeah.
And when they have a baby, they have to choose which two to maintain and sustain.
Yeah. So you see, look at it in this way. I'm yet to find a nurse who is not in management position or having a side hustle or stuff, affording a house in a good neighborhood. If you look at us now as nurses, there's a trend. Most of these new developments, if you look at it, they are meant for nurses, police, teachers. And if you look at it, even the space that they're located, the house, the size of the house. But and these are people that we say they are the backbone of the health system. Okay, we are the backbone, fine. Where is the hands and the limbs and the head and the stomach of the profession living? Of the health science? They're staying in Santins, they're staying in Felens, North Cliffs, good neighborhoods, safe neighborhoods.
How does, because you're saying that nursing as a profession does not uphold the dignity and pride for the professionals that are practicing it. How does that now translate to the vile attitude that we get from the public? I don't even want to call it a vile attitude, because the attitude is what they say nurses have. How does that now speak to how does that speak to the negative perception that the public has of us? Can you pause there for a second? Let me save these two things.
So
how does that now?
You were talking about the negative.
I'm saying the how does this nursing profession translate to us being disrespected by the community? Us not being able to afford houses.
Look,
us not being able to afford better cars.
I'm going to give you an example with Bara, because Bara summarized the conditions of nursing, of nurses in general, because I was there, I saw it, I observed it.
Yeah.
Bara, if you go to the main entrance as Bara, there is the pathway for the cars, and then there's a bridge for pedestrians.
Okay.
You go in Bara in the morning, around 7 o'clock, or around 6:30. Most nurses will not come in through the gate of where the cars are going to come in. They will come in with
the pedestrian
side. Number one. The other professionals will then drive in. So that on its own, it shows you the inequality that is there. Remember, we are living in the world where we don't respect the person for who they are or how good the person is. We respect what the person has or what the person can do. Now, you as a person walking, I'm walking with you to the hospital. I'm also sick.
On the pedestrian
path. I'm walking with you to the hospital. Already in my head is, you can't afford like me. Number two is the same nurses. Some of them hired rented rooms,
Okay.
bag rooms, or bag mukukus,
Yeah.
because they can't afford. Remember, in nursing, we have 3 categories.
Yeah.
We have the professional nurse, the enrolled nurses, and the enrolled nursing assistants.
Yeah.
The enrolled nursing assistants, the ones that we are saying they can't, if they have to choose between a car and a house, it's a professional nurse.
The one that is at the highest. Okay.
The 2 middle ones, already, if this one who's the highest, the professional one,
Has to choose.
has to choose between a house and a car, the others, where are they falling? They can't even, the bank won't even consider them for any serious loan when it comes to whether financing a house or financing a car. You see,
And those are in majority, because
And
I remember where I was working, the ratio for every shift, you find that there's 3 professional nurses, then there is 6 of those 2 categories.
yeah, at least when you are from Joburg, Gen, the staff ratio was big. At Bara, you will be the only professional nurse with 1 enrolled nurse and 3 nursing assistants.
Sure.
So the patient ratio in Bara it's crazy, Chan. So it comes again and say you can't overwork someone.
So these 2 are on the pedestrian pathway, walking with their landlord.
Yeah.
That's what you were saying. Is
So they are working with the landlords. And yesterday was weekend. You were off. Me as a landlord said to you, you must clean my yard.
as the nurse.
As the nurse, clean my yard. I want my yard. I want you to put polish on my stoop. And tomorrow morning I find you in the hospital or the clinic. Will I respect you? I mean, you are my tenant. Okay, you can't tell me. I'm the landlord.
I will evict you.
I'll evict you, Chama.
And those things happen. Those things happen.
So we need to look at certain elements and say, if we want this country to go forth, we should not,
If you want this profession,
profession or even the country as a whole, we shouldn't overlook certain issues that plays a huge role, because they directly impact, or maybe indirectly impact the profession on its own.
do you think nurses feeling disrespected, feeling walking around with this compromised dignity has an impact on how they carry out their duties to patients?
It does. But remember, it will then come to individual. If you want to talk about quality nursing care, you need to allude to say a lot of things. As we are talking now in South Africa, there's a huge shortage of a lot of things. Number one, you can't talk about quality nursing care in a ward that is like Bara 78-bedded ward with only 4 nurses or 6 nurses.
The quality is
You
compromised
can't.
already.
It's already compromised. You can't. 2, you can't expect someone who has to bath maybe 70 plus patients. You can't expect them to be smiling.
Why? Because you're supposed to carry out your scope of practice with
But the number.
with pride.
I will smile first patient, second patient, 10, the number 10, I'm tired. The body on its own is tired.
So it's not practical.
So it's not practical. So our ratio, it's not practical. Even if they say, Chana, you are not the rude person, you are the most sweetest person. The body on its own, you will be so tired that you can't even smile. By end of the shift, you are so tired. By the time we go to visit, all you want is to sit down. And now you are seen as someone who's not attending to visitors. But you've been standing.
But nurses are rude sometimes, man.
I'm not taking away that there are people that generally are rude, but I can assure you something.
Yeah.
Policemen are way rude.
Don't shift the claim. Look at this guy pointing fingers.
I'm not pointing
Then
fingers.
the police will say, Home Affairs, people are rude. Teachers are rude.
See,
Now we are saying nurses, but there are nurses that are rude.
There's no
I'm saying this
profession.
because I've seen the...
There is, and I'm saying to you, what I'm trying to show you, it's an individual thing. As much as you have seen rude nurses, I'm sure you have seen caring nurses.
A lot.
Exactly. You see, so it's not something that only is constrained in the nursing. You will also find it in other professions. There are doctors who are rude.
I've never heard that doctors have attitude.
Oh, they have. But remember, he drives an M3. So even if he speaks to me anyhow, we are not in the same level.
You want to tell me that the community is much more receptive to doctors' rudeness or other people that are in higher positions, ill attitude?
Let me give you an example.
Yeah.
Right now, if Ramaphosa was to come in the room and tell us our news, we'll keep quiet and won't see it as rude. But someone else who is not in the caliber of Ramaphosa comes in here and tells us something. That person, we will tell that person now, because by virtue of being a human being, you are already biased. How you address a person, you look into a lot of factors. How they've dressed, how they're addressing you, how they look. And by virtue of being a human being, already you classify a person. You understand? So even when it comes to professions, if you look, a patient, a doctor can come in, don't greet the person, write whatever they write. They will even be afraid to ask a question to the doctor. No? The doctor will go. And then the nurse comes. Then the nurse, the doctor, what did the doctor say? And the nurse simply say, but the doctor was just here. Why didn't you ask the doctor? Then now you are rude, the nurse. Nurse, you are rude. But the nurse is asking a simple question. The doctor was just here.
Yeah,
Why
but
didn't
you're
you
supposed
ask?
to be an advocate for the patient.
Yeah, but when you advocate, what is an advocate?
Speaking for, representing.
Yeah, but in this case, what do I need to advocate if the two of you, what's stopping the patient from asking the doctor to say?
The doctor is very busy.
So what is the doctor so busy of? Isn't it the doctor being paid to look after you in terms of the health?
Yeah.
So is he not the right person to be telling you what is wrong with you?
Okay. It is.
So the nurse is not busy.
The nurse is busy, but the nurse is the
But
way
they are
they
not in the
respond.
same business. There's another one who's busy than the other.
Now that you're a nurse, right? If you know, I remember I asked you, what does being a nurse mean to you? And you didn't give me.
And let me give you an answer. What
Yeah.
does being a nurse mean to me? There are two elements into it. There's an element of nursing as a profession that I practice, me having the obligation to fulfill my duties in terms of my scope of practice and in terms of the policies of the organization where I work. So being a nurse means that I need to take care of someone. I need to give that particular person information regarding their health. So one, I need to either prevent illnesses, diseases, or stuff. If I can't, we then need to cure them, diagnose them and cure them, if we can cure them. If we can't then cure them, we need to be there as a nurse to rehabilitate the person, to say, how do you live with your disease? You understand?
Yeah.
So these are elements that constitute a nursing.
A nurse, yeah.
Yeah, but being a nurse, it's a beautiful profession. But it's not a profession that you can sell to a young person. Because if I'm struggling myself to make ends meet, why will I then want to sell it to someone else?
To invite someone to suffer with you.
You see, but that's what I'm saying, it's into two parts. The part where it has to do with the profession, me rendering service, is beautiful. But the part where it has to render service to me as the profession, in terms of looking after me, it can't.
It's failing.
It's failing. And that is where, if you now look at it, because the profession is failing to take care of me, then I also fail to take care of the profession. Now, a failure becomes failure, a failure becomes a failure. Now, then you see that the profession on its own then becomes compromised. You see? So we need to be, we need to tell the truth. We must never tell this thing, no, nursing is a calling. You must not talk about money. At the end of the day, after I leave work, I have to eat. My kids have to eat. I have to live somewhere. I have to commute to somewhere. I commute using money. I don't commute using passion or thank you that I get from people.
Good job.
Good job.
You've
I don't
done
commute
well.
from a good job. I don't commute with saying, hey, Mdaka is a very good nurse. That does not make me commute. What will make me commute is maybe government must then give us cards where they load good things about you. Then the card, when you go to Pick and Pay, you don't pay. You produce the card to say I'm a good nurse. Maybe. when you go to the bank, you don't pay the money. You say yes, the card, I'm a good nurse. Maybe we will start seeing. But as it stands, the profession does not really care about its own professionals.
What is keeping you in nursing now that you've been exposed to all of those possibilities, routes? You already have a background or a backup. Qualified, you went to do a specialty. I must be calling you master by now. Not so long ago, I'm going to be calling you doctor. It seems like you're still investing your energies and efforts into this profession. What is it that is keeping you here?
You see, I said to you, the nursing profession is like, the opportunities in the nursing profession is like a pyramid. For you to get up, you need to work harder.
What is up there?
Up there, there's a lot. There's a lot, Chana.
What?
Up there, there's a lot. You can either become a nursing entrepreneur, you can either become a professor, you can either become a lecturer, you can either start your own hospitals. There's many things that we can do as nurses.
I was talking to a lecturer friend of mine, and she was like, hey, this thing is just status. I'm telling you, when was it?
So if
Yesterday morning, she calls me. She's like, I want to apply to be an occupational health practitioner. I'm like, I thought you were a lecturer and you are hip. She's like, this thing is just a status.
It is true. see, Mr. Mdaka, in any profession, you will have those that understand the mandate of what a job is. A job is not there to make you comfortable. Because if a job is there to make you comfortable or make you rich.
Move your mic down. I don't want to see your face. I can still hear you. Yeah, move it towards your phone there.
Yeah.
Back.
So the job on its own
Please.
can't make you rich. It can't, because they have to retain you. You have to come back for the salary.
True.
If you didn't have to come back for the salary, I mean, why would I go to Bara at 7 o'clock in the morning and leave at 7 in the evening if I can afford my needs?
It doesn't make sense.
You see?
Yeah.
So by virtue of being a career or by virtue of being a job, is that you will never get paid enough. You understand?
Yeah.
So you will find someone who is specialized or who's a professor in nursing and still cry and say there's no money.
I
never can. You see, you will, because a job is not there. You can't be Elon Musk with a job. You can't be you can't be Petrus Mutsipe with a job. A job somehow is meant to you. It's meant for you to lag somewhere so that you can have the drive to go back to get the salary. You see. So what I'm saying is, it is better if you are maybe a lecturer in the university or somewhere else than when you are still in the bedside.
In the bedside.
Because number one, in terms of physical strength, when I was working Kopar, every day when I got home, I used to have a back pain. Because you have to lift these people. Physiotherapists see patients, or autists, they see patients, they leave them on the chest. People who can't even walk, they can't climb the bed. As nurses, we have to lift these people up back to the bed. You see, by the time you get home, you are tired. But if you then look at the lecture in terms of physical, yes, mental strength, yes, you might get tired. But in terms of physical, the one who's at Bara is more exposed to more strained work. That is one thing that is better. The working conditions and the working hours. There at Bara, it's 7 to 7. But if you go to university or you like us, occupational, you come in at after 7 and 4 o'clock you leave. You see? Weekends you are off. Holidays you are with your family. But when you are working, when you are still down there, you are not a specialized nurse. You have to, whether it's Christmas, whether it's New Year, whether it's what, you have to be at work.
Are you planning on leaving this profession? Or you want to go up to the top peak as far as you can go with nursing? Or at some point in your goals, I know it's a construction company.
Being a male, the responsibility piles up. Because like you said, when we started, I practice fire culture. I believe in having kids. As I mean, I need to plant my own seed, need to plant my own DNA. They need to continue. And those DNA need to be protected. And how do we protect those genetic makeup and those DNAs? You need to make sure that they have a good structure in terms of a house. They get good nutrition so that they are not easily targets of diseases and stuff. And you must make sure that they can compete socially, so they need to get good education. So that by virtue of the responsibility of being a male, and you look at what nursing is paying you, you can't.
You can't stay here, or you can't.
You can't stay in the profession. You can't.
You mean you're contradicting yourself. You're saying that you need to push. This is a pyramid. You need to push to the top.
Yeah, but we just said we just said just now. Even the professors are crying. Even the lecturers are crying.
Are those who we consider to be at the top?
Yeah, those are the. There's no.
There's no topper than that. No, man.
Which one is topper than that? Because the topper one is, you have to start if you remain in the profession, you have to become a nurse entrepreneur where you start your own private practice using the skill.
Yeah.
But on its own, if you take a client right now, you put a client here, you give the client 500 rand, and they have to choose between seeing a doctor and seeing a nurse.
They won't go to the nurse.
They won't go to the nurse. They will go to the doctor. So the nurse entrepreneurship on its own, there's its own challenges. Remember, when you open your own practice, you are in competition of the public health system. You need to beat the public. If for example, in the clinic, I don't stand the line, why would I want to spend the money to be consulting if in the clinic the lines are very fast? 2, if I have money and I have an opportunity to go to the doctor, why would I want to go to the nurse? You see? 3 is, despite all these challenges, you have to buy supplies like medication. Medication is expensive, and you have to sell it to someone else. At what price are you now having to sell the person? Let's say, for example, a packet of antibiotic, it's maybe 120. And you are a nurse who has a dispensing license. The packet of antibiotics is 120, where you buy it. How much you now have to sell it lower than 150? Because if you can sell it above 150, the same person can get those same antibiotics at the clinic for free, or they can go to the doctor write the prescription, and they get them good clicks, the generic name, the cheapest, they get them maybe less than 120. So the competition is too high. It's too high. And I'm not saying they're not making it. They are killing it, especially in the area of midwifery. They are killing it, especially in the area of mother and child. The immunization is they are killing. They are making the man. But there is this thing in South Africa that people prefer to get care
from doctors
than nursing professionals. You see, so if you go the entrepreneur way, remember, it's like any other business. You won't see profit for the first 3 years. Who's paying your salary?
How are you paying other people's salaries?
How are you paying? Remember, now you have to hire professional trained people who are nurses. Why will I want to come and work for you and you can only pay me maybe 5,000? If a Bara, they can pay me 17,000.
Doesn't make sense.
Doesn't make sense. So you find that you have to be the main person. You have to work.
Now, but you know what? Sitting here listening to you and saying all of these things, it clicks to me, or it rings in my head. We are trapped. It's a deprivation trap. It will take a miracle to take nurses out of this trap, because I doubt the government is doing or planning on doing anything to uplift or improve the nurses' salaries in order to make sure that their dignity is upheld. I doubt that there's more nurses that actually want or would even survive even if they want to go towards the entrepreneurial route. There's no hope for nurses.
Yeah, so the answer I was saying to you, as a male, being a provider, culturally, as the Khanyaho takes us the repo rates and all these things, every day I afford less
As a man.
as a man. Then that is where you now will ask my wife to start assisting. And when she starts assisting, then what must happen? The submission also is half.
Full submission is subject to full
Provision.
provision.
Now there's 2 males in the house because she will be telling the truth. She wakes up the same time with me, contribute like me. So why must she submit to me? Why must be she? Why should she be the one submitting to me? Why shouldn't it be me submitting to her?
Eyes is sinking in is straight.
So
it's sinking
by
in.
virtue of the profession on its own and the salary package, it then forces you as a male. That's why you will find in the occupational, you will find more male nurses than any other specialty.
Why?
Because occupational tends to pay better. You can negotiate your salary. You understand? That's why you'll find more nurses, more male nurses are not in the
Bedside.
Not to say they don't love doing what they're caring for the patient. We do. But remember, when I go home, my wife doesn't eat the caring that I've been giving to Bara.
Which unit did you work at? When you were in bedside, before you started living soft and affording nice cars.
Yeah, but I drive a beautiful car.
And living in a nice
when I
suburb.
bought it, the time I bought it was the top of the range of that model. Because I like nice things.
Yeah.
Okay. Before we started practicing as a clinician in the primary healthcare and also going for occupational, I worked in maternity. I worked in casualty.
Maternity.
Yeah.
You delivered babies.
Yeah, bruh.
Did you have a baby named after you?
No.
I have 3 babies, 3 if not 4 babies named after me.
Yeah, at least the fathers were not there.
One was there.
The fathers of the kids are not there.
No, the father was there. One of them was there. One of them was there. The mother went there and said, I want us to name this child Sipesi.
Yeah, when they get home, the father said, why must I name my child with another man?
I was very good. I was good in midwifery. You worked in midwifery?
Yeah, I did.
As a culturally...
Yeah, I did.
Did you enjoy it?
Actually, contrary to belief,
Yes.
I reproductive health.
Okay.
It's one of my strong areas. If I was to put it like that in terms of...
I'm sorry, my dirty mind is telling me something
No,
else.
not in that way. Not in the way.
This guy was talking about planting a seed everywhere. And now he's one of his strong areas.
No, I'm not planting seeds everywhere.
Push it
No.
that behind you.
Yeah.
Now your extension. Hey, push it.
So the issue is specific.
Yes.
As a man, you must be responsible of where you are planting the seed. You don't
Okay.
plant everywhere.
Yeah.
You don't plant everywhere because hey,
Kunzi.
you'll die before your time.
Yeah.
So I enjoyed, or rather, I saw growth in the reproductive health.
Okay.
Even when I the time when I wanted to be a doctor, I wanted to be a gynae, contrary to belief.
Tanda my vagina.
See, and there's a reason for that, one of my reasons why I was drawn to that more than any other reason, even when we did the BK, first year, second year, my BK, my specialty was I wanted to do advanced midwifery. But due to the conditions that we exposed to Bara, I changed it.
Okay.
So the reason why I was drawn to that was the maternal death rate and the child mortality rate.
Okay.
So when you look at in Africa, kids that are whether from pregnancy until 5 years, that's where there's higher risk of death for kids because of many things. The socio-economical status is actually one of the contributory factors. So I wanted, when I went there, I went with an idea of saying, if there's an area where I wanted to make a difference, it's an area of, I want the women that comes to the hospital to go home with their lives intact and with the lives of their babies intact. That's why I was drawn to that
Field.
to the field. See, if you know me, you will know that I believe that black people's population must go.
Yeah, every day.
Yeah, you know. So I wanted to protect that and say the women must not lose their life because of childbirth. And the babies must not lose their life because of maybe we don't have skills or we don't have equipment or we are ill, the population in terms of ratio and stuff. So I wanted to add into the number of saying there are now well-trained nurses or aquachers or advanced midwives. You understand? So that area, I was drawn mostly because I wanted to come in as a solution in that element.
In that element, yeah. Okay, I'm going to go back to that question again. What do you think about contraceptives?
Which answer do you want? Do you want the answer that as a
No, I want.
or you want the answer as the nurse in me?
Let's start
Or
with
you
the
want
health.
the answer as a black African man.
Let's start with the healthcare practitioner.
Okay, as a healthcare practitioner, the contraceptives are assisting in terms of family planning. They allowing women space, allowing their bodies to heal from the previous pregnancy, because pregnancy is one of the most stressful thing that a woman's body can go through. So it is allowing us to afford our little ones better.
Okay.
Because you can start seeing, oh, okay, when I get a promotion, I'll have another one. For as long as I'm still here, let me...
Nothing.
Yeah, you see. So they are doing well because we don't see, we no longer see those elements of every year a woman is in labor ward. And you see.
Okay.
Because that on its own becomes very strenuous to the child.
And as an African man?
As an African man, it's nonsense. I think if we need to first, as African black people, we need to find, if we want to do family planning, we need to go and develop them ourselves. Look at the element on its own. What is in there? What is our women consuming? Because I can assure you now, there are many women that, hormone-wise, they are not doing well because of family planning. Their hormones are not balanced. Some of them, I don't have research to prove this, but you might find that it's also contributing towards the depression rate that we have when it comes to women. Two is that the system is taking away the consultation between the man and the woman. Now, a woman, you can say, you can plan to have a child with a woman, but the woman can privately take family planning, and you will never know about it. And
they had it in their lockers at work.
And then you find that it's for years, and you start even consulting men clinic, and you think you have a problem, and the lady is choosing to not to have a child, which is good. that will also fall in the other side of saying it allows the women to have a choice with their bodies. But now it takes away that element of consultation as the husband and wife to say, me as the husband, I'm ready to have a child or not. In other element, women also use it to say, you ask them, are you in family planning? She says yes. But you find that she's ready to have a child and she doesn't tell you that to say, I'm no longer on family planning. Then she falls pregnant and you were not ready to be a father, which is many instances, that's what we see now.
And others have problems conceiving after they've been in some...
problems with conceiving. And there's many health effects that we need to talk about them. And they are actually destroying the nation as a whole. Another one is the issue of, remember, specifically for me, I need to be here. It meant the man and the woman met. So if men and women don't meet, it means the next generation might not be there. You see? But looking at the affordability, I understand why people will now, because mina now school in Maka. We were raised in the rural areas. We ate mroho and pap. Yeah, you see. But I wouldn't really advocate it to say, if we can, the first point of departure will be, we need to first find treatment or family planning methods that will work for black women. Because the current one, I don't think they are at the best interest of black women.
Hey, I'm tempted to go towards the route here where Bill Gates is funding these things and whatnot, but I'm not going to go there. Let's go back to labor ward. He wanted to specialize in women. You said it's women health, reproductive health of women, right? How was your experience in labor ward?
I was exposed to a labor ward of a very busy hospital. Both of them were trained in Natal Spruit and also where I worked at Bara.
So you worked at labor ward as a Bara?
Yeah.
A Bara is a tertiary hospital.
Yeah.
So meaning that if there are complications in some of these small hospitals, they send it to Bara. Yes.
Yeah. Which is, we are exposed to many conditions, by the way. You get to be very competent because you meet out of this world conditions. Things that you read in textbooks, in Bara you meet them. But the patient-nurse ratio, it's not fair.
Too many nurses for these patients.
Few nurses for the patients that we are experiencing. For example, there was a night, so Bara's labor ward is divided into 4 parts. There is admission, and first stage, and then...
what is first stage?
I will explain. And then there is the delivery, and then there is the high care. So admission is where everyone comes in. We tlag you, you get clagged,
we register you.
And then we assess to say, are you in labor, are you in true labor, or it is a false alarm? And if you're in true labor, what stage are you at?
So the stage is where
you in active stage, or you in latent phase? Where are you?
Yeah, so that is when you check your cervical dilatation.
Yes. So you'll find that in the admission, by then there were about 6 beds in the admission, and there were about the waiting area was not that big, but it will always be packed. Will always be packed, and you find that you are only 2 midwives, at most 3. And
now this waiting area is packed with pregnant women.
Pregnant women
still need to be registered.
And still need to be assessed to say, where are we putting you? And some of the time, even if you are in active stage, like say you are 8 centimeters and stuff.
So active stage, it means that you are closer to delivery.
Yeah. We need to take you to maybe delivery room. In delivery rooms, which were 20 cubicles. You find that they are full. There's other women that are also active. They are in the same stage as you. We can't take you, then you have to remain near. Now, what are we being exposed? We are exposed to, you don't have a bed to deliver it. And if something happens, this the nurse that is going to be blamed. You understand? They are not going to look to say how busy you were as nurses. So it's
And this is only 2 nurses.
No. There's 2, 3 in the, and then there will be about 2 allocated in the first stage, and then there will be maybe 2 allocated in the 20 cubicles of delivery.
Wait. So these 20 rooms of delivery.
Yeah, these are people who are ready to deliver.
Who are ready to deliver? I mean, how many midwives?
2.
Aye, man.
I'm telling you.
No.
I was there.
Yeah. Wait. So now a person is, let's say it's between 8 and 10 centimeter ready to deliver. You send them to one of those 20 rooms. Meaning at a given time, anyone in those 20 rooms, they can deliver.
Yeah.
And you've got only 2 nurses.
Yeah.
Who else is there to assist?
No one is also there. You will be like, if there is the rotation of the students, then you are lucky because they're students. You see?
Doctors?
Doctors only come for complicated stuff, Chana.
How do you manage? How do you manage to deliver?
That's why we leave. That's why we leave them with their hospital.
Is it still safe practice?
That's why I said to you, you cannot talk about quality nursing care when the ratio is it's abnormal.
Jesus.
You see, you cannot talk about that. Maybe now things have improved, but I can assure you that there are fewer people who are drawn to the midwifery, because midwifery there's a lot of litigations.
People come back to sue the
hospitals, and we are not protect as much as now. There's new rules that says if the hospital is being sued and they find you that you were negligent, they will take from your pension fund. So the people who will want to go there, because on its own it's risky. Like I'm explaining to you, there's not enough beds. Number one, there's not enough staff. And then let's say someone delivers on the bench, and I'm allocated to work in the admission. Obviously, they will say I was negligent.
It's your responsibility to
my
allocate a bed.
responsibility. But what if I was attending to someone who was delivering on the bed? Will you listen to that?
You won't.
So those are the things. So the reason why I end up leaving even this registering for advanced midwifery and did occupational. By the way, occupational was not even something that I wanted to do. Is that we had a very busy night in the labor ward. And in the morning, we had near misses. You know, there's these meetings that they call and they talk about near misses to say, hey, there was a child near miss or mother. M&M meetings and stuff. We were in that meeting. And in that meeting, I remember we were very short staffed on that night. We were, I think, 2 in the, because I was in the admission, I think we were 2. And the other areas, we also needed to assist in the other areas because they were short-staffed. And there was a lady who nearly delivered on the floor.
So that was the near miss.
Yeah. And it was a big thing because, you know, nowadays, because there's cameras and stuff and there's issues that's circulating on social media and stuff. Sometimes you see yourself on the newspapers and TV, unaware. So it was those cases that we were blamed to say we were negligent. Why didn't we prioritize? She was the priority. But remember, we were there.
She was not.
The people who are blaming us, they were not there.
I'm saying based on your judgment, she was not a priority.
She was a priority, but there's also a priority.
7 priorities and there's only 6 beds. The other priority has to be on the chair.
You see? Yes, maybe the other priorities they were also maybe 9-10 centimeters, including her was 9-10 centimeters or 10 centimeters. I removed that one, I put this one delivers on the floor. I was still wrong. You understand? I'm still wrong either way. So the issue of being blamed, everything being shifted to nurses. You see, in the hospital, there's this thing, everything that goes wrong is nurses. Everything that goes right is doctors.
So they blamed you?
Yeah, we got blamed. And I told them the same day, told the matron same day, or you know what, from today, I'm leaving here. Going to all go to work somewhere else. And they thought I was joking because it was night. In the morning, when we can see the way the inconsiderate is, you work the whole night without rest, which is obvious you are at work. But in the morning, they should allow you to go. No. You are set in these meetings until 10, 11.
And you're supposed to come back again.
And you're supposed
at
to
night.
come back. And no one pays you for that time.
Why are matrons not so sensitive to nurses' concerns and working conditions? Yet they are also nurses themselves.
They are too submissive. They do things to please others, not for the profession.
Who are the others?
The management of any facility. Even if you look at the operational managers in the clinic, they do the same thing. They would rather put you under the bus than protect the profession and protect you, because they want. Remember, these are individuals on their individual capacity. They still want growth within management. They still want to go claim high. They want to be directors, deputy directors. They want to be whatever. So if you seem to be someone who takes the side of the nurses, you will be seen as someone who's not firm towards nurses. So why would we promote someone who's not firm? I mean, nurses bazozenzela muswena uya phezulu. You understand? So they are also looking at their interest.
Mugalana, we spoke. We are almost nearing 2 hours now. But I feel like it would. Me and you are still gonna sit down. That one is a show. You know, we still have a lot to unpack, a lot to discuss. Take me, or share with me, one. I don't want to say unbelievable, but I'm almost tempted to say that, because what you are explaining to me as far as the staff-patient ratio in labor wards and whatnot, it's almost unbelievable. I worked in labor wards, and I think Rahima Musa, where I worked, had 1, 2, 3, maybe 6 or 7, I stand for correction, labor rooms to deliver, you know, and I've seen out of all those few, in comparison to Bara delivery rooms, I've seen a lot of scary things in the labor wards, right? One day because I was not at the forefront on that one, delivered a baby from a 14-year-old. Oh, that was one traumatizing thing. As a nurse, witnessing such a small body going through all of that, it was scary. It was as if she's dying. I've witnessed a woman that was struggling to conceive for a long time. And when she finally delivered, the baby passed on. And we invited the husband to come into the delivery room. Watching them kneel next to the baby, crying, it broke me. I've witnessed a woman deliver a baby, and as soon after we cut the umbilical cord, she said, "Take this thing away from me, I don't want to see it." There's a lot of things that I've seen in labor ward.
Yeah, there's a lot.
You know, and I just want you to share with me some of the things that you've seen and that have touched you, that made you to actually, as busy as the labor ward is, but this event made you want to take your gloves and sit down and were like, whoa.
Yeah, there are many instances, my man. There are. Remember, these are some couple years back. Some of them will not be as remembered, but they are. Ones that are coming on top of my head will be the first time when we lost a mother during delivery. So the child is born, healthy baby is born. We remove the placenta like we usually remove. And we take the baby for weighing and stuff. And a few minutes from there, the lady started bleeding.
Okay.
PPH, postpartum hemorrhage. This is bleeding after delivery, vaginal bleeding after delivery. So the bleeding was excessive. So we attended to her. Everyone left whatever they were doing. We attended to her, and we started the process of trying to remember if someone is bleeding, you have to transfuse and all that. So we were trying to get veins, bigger veins where we can do transfusion and stuff. But because she was bleeding, the veins have collapsed. So we looked for veins all over.
So because now the veins, the blood, the body is losing so much blood.
Already delivered on its own.
Yeah.
You lose blood.
So the blood vessels, they actually...
Yeah, they collapse. Yeah, they become small. We couldn't find.
Not even one.
Yeah, even doctors came. They wanted to do,
CVP.
Yeah, CVPs and stuff. They failed. That was one of those days that you just want to take your gloves, take your bag, and go home.
And how was the baby?
The baby was healthy. Beautiful baby.
And maternal deaths are a big thing because they were on the millennial goals of development, if I'm not mistaken.
That is the reason why I wanted to go in and do become an advanced midwife. Because that is the reason to say I'm also wanting to join government, join everyone in fighting the maternal death. Because it's not fair that a woman has to sacrifice between her life and the life of a child. So now it becomes an issue of if you get pregnant, it's now a 50-50 issue. You see? So another event is, you see, I'm more inclined into the ancestral spiritual belief.
Okay.
But as much as we know, there's a God and stuff. But that day, it's one of the days where I witnessed miracles. We delivered the baby. There's what we call fresh stillborns.
So this is when you deliver a baby and they're dead.
And the child is fresh. It's not macerated. They didn't die from this. They might have maybe the injuries during when they are navigating or whatever. But this is a child that we resuscitated. And
So you suspect they didn't die before delivery. They died during the labor process.
Yeah, they didn't because through before delivery, the baby was fine. They had monitoring, so showing us that the baby is fine and stuff. Now, after resuscitation, pediatrician resuscitated and everyone resuscitated, and where they gave up, and they say, you know what, there's no more life. Now the child is put there in a linen saver, wrapped in a linen saver to say, I know, there's no life. We are now completing paperwork. We hear this child started coughing.
Hey, when?
And start crying.
Hey, when?
when you ruled out this one.
On a linen saver, not even on throw sheets.
No, not because now we were preparing for last offices.
That means in Bara miracles happen because I was talking to Gwanele, and one day she told me on an interview that we had, she told me something similar. It was during a C-section when they delivered and the baby also woke up. Miracles do happen.
Yeah, they do. They do. See, the thing about it, that's one of the processes where you get to appreciate nature and you get to appreciate the power of God. And if you believe in God, if you believe in whatever, you get to appreciate whatever you believe in. Because you may see things that will amaze you. Sometimes you go in there, you are expecting the head to crown, you to see the head when you are inspecting. But you are met with the leg, Sometimes you are met with the bum, So there's many things that are happening.
For the sake of time and for the sake of wrapping up this this conversation, if there was a message that you were to give to our female nurses, I know you are pro-man and pro-African, to our African and non-African women or females that are watching this, be it in nursing and be it in other professions, as long as they are female, you as somebody that is in love with reproductive health, what would you advise them? I know it's a broad question, it's vague as it is.
It's a vague question, and it's also throwing me under the bus.
No, advice. I want you to give an advice to women, as a summary to
what we've been talking.
To what we've been talking about. Let me just maybe highlight some of the things that come to mind.
No, it's fine. Let me answer it from the broader perspective.
Please.
Female have a very interesting reproductive health, reproductive organs, in terms of the structure, in comparison to males. And for that reason, it is very important to look into issues of how to maintain good health, even before you fall pregnant as a female. Generally, your health needs to be well. You need to have maintained good health in terms of exercising and stuff and all those things, in terms of eating well and stuff. But you also need to make sure that you go for screenings. You do breast examinations. You go for mammograms. If you feel something that is out of ordinary, you need to go and seek medical attention. You need to do regular pap smears. Whether you are HIV positive or not, you need to present yourself for pap smear so that you see whether you are at risk of any illness, whether it's cancer or stuff. Because it's amazing, it's very sad that there are certain viruses that when they, like HPV, when they come in contact with the woman's reproductive organ, they trigger cancer. And those are some of the things you can screen for, especially if you are between the childbearing age and you are sexually active. You need to go for these things and to go and screen for these things. And again, you also need to be one that needs to minimize the issue of having multiple sexual partners. And if you do, then you need to take care of yourself. You need to use condom. But remember, condom does not prevent all the STIs. So you need to use the use of condoms. And you also need to make sure generally, there's many social things that are done in the communities. You will hear some talk about the certain element or certain mood or something you use down there to keep a man and stuff. Shy away from such things and stuff, because those things are later on cause very drastic
undesired effects.
Yeah. You see? So, and also the issue of testing of HIV. If you know that you are sexually active, you must go there and test for HIV and all these STIs and stuff. But again, in the same note, we as men need to protect women. The issue of sleeping here, sleeping there, taking this one, taking illness from this side, this one, introducing to this one, needs to come to a stop. And I know a lot of people have been like, yeah, but culturally, men are
polygamous.
Are polygamous and stuff. There's a difference between cheating and polygamy. Polygamy is done in a respectful and controlled way. You cannot go around and say, yeah, daughter, that is cheating, that is being reckless. Polygamy, actually, you don't start sleeping with a person up until you have paid lobola to that person. So we need to be very careful of our culture. and say, I mean, I must go. No. Our cultures, that's why we're interpreting them wrong, number one. And because we're interpreting them wrong, then open this loophole where people start saying, no, but this culture, it's not fair towards women. You understand? Mm-hmm. Because we are interpreting it wrong. So we as men also have a huge role to play when it comes to sexual reproductive health of women. You need to protect your wife or your girlfriend. Mm. You must use condom as a male saying. Particularly when
the very same contraceptives that you are not for.
Yeah, but see, China, we are living in an era. You say, if it was the era of my father, there was no HIV in the era of my father. Mm. That's why maybe they were able to do whatever they were doing.
When you would say how many kids your father had?
With my mother? Yeah, 10. I'm the number 10.
When you say with your mother, he had other kids with
other? That champions.
Lancellot, thank you very much, my man. We started with culture, we went into nursing and anything in between. We ended with culture. I could not wish for another better sit down.
Yeah,
we shall sit down, we shall continue, we shall keep on talking. The conversation will go. You are a friend of the show. That's what they are calling them. Yeah, a friend of the show.
We did not link culture in many ways. We talked about it, but in another day, we will link into it. We will link culture in terms of the nursing profession on its own.
Yes.
Because we did not link it. Mm. We will link culture in terms of the quality of life that individuals, black people, can have.
Yeah.
Or we were having, or should be having, or we are living in terms of culture related. We will link culture to the issues of women's reproductive health. Because now comes the issue of, in culture, it is unheard of that Mdaka is the father of this firstborn, the secondborn is another father, and the thirdborn is another man, you see. So those elements
need to be brought into...
Yeah, if you look at our fathers, our mothers, it will be all of us, we will have the same father in the household. So we'll have to link culture in many aspects.
In many aspects, yeah. I'm very much more interested in that, and especially the ones that come to nursing, because our podcast has to focus in nursing.
Yeah.
How does culture influence nursing practice, and how does it come into play with nursing practice?
Yeah, we also need to talk about the influence of culture in terms of the attraction of young people, particularly males, into, because I think it also does play a barrier.
Yeah, who's your business sister?
You know, who's your daughter, your seventh profession abafas. There's another that element again.
And most of us, but they never just gay.
Yeah, well, which most if you look, those that are in the profession end up becoming gay. If you look at our profession, you will see there are times that when we were training, they were not gays.
Now they look at other men.
They're now gays.
They're traumatized by the things they see in the labor wards.
We don't know.
Thank you, my brother. Nursing care continues with Nollen. And until we meet on our next episode, thank you very much. Boom.